Hello everyone, myself Dr. Maddineni Srinivas. So you might be knowing that recently monkeypox, which is also called as MPOX, has been categorized under the health emergency by World Health Organization. So I wanted to just show you few important points related to the manifestations of the monkeypox over the skin. So you might be knowing all these points. So I will just keep them in the slide so that you will just read them by pausing this video. And I want you to focus on this point. The clade 1B, the new variant, has been labeled the most dangerous yet. So this is the clade 1B, which you need to remember, which is a dangerous type of the monkeypox. So how is this monkeypox transmitted? It is mainly through skin-to-skin contact, also respiratory droplets, and also through animals. And you must remember the incubation period as a range from 1 to 3 weeks. 1 to 3 weeks. Okay. And there are two important stages: pre-eruptive stage, where there will not be any skin lesions, and eruptive stage, where there will be skin lesions visible over the skin. So in the pre-eruptive stage, please remember the patients are going to mainly manifest with fever, malaise, myalgia, body pains, headache, fatigue. So these are all the symptoms. Usually like a normal viral infection, patients are going to have symptoms. And this stage, it was observed that it was, it might be from a range of 1 to 10 days. In this period, patient of monkeypox may only be having these symptoms without any skin lesions. And even also loss of appetite, sore throat, difficulty in breathing, dyspnea. So all the respiratory symptoms might also be present. Cough might be associated, and it might be dry cough or it might be wet cough that is associated with the phlegm. And also there will be lymphadenopathy. You can see there will be lymph nodal enlargement in various groups of lymph nodes. As you can see, cervical chain, it can be submental, submandibular, and also inguinal group. So we can say generalized lymphadenopathy can be present in this pre-eruptive, that is prodromal stage of monkeypox. Whereas coming to the eruptive stage, in this stage, we are going to see a rash. So a fever followed by a development of the rash. And this can take place, like I have told you, 1 to 10 days after the onset of the fever. And initially, the lesions can be seen over the mucosa, as you are able to see here over the lips. You are able to see there is some kind of a lesion. Okay. And slowly it is going to progress to involve the face and other parts of the body, usually the trunk, extremities, and the scalp. Even the palms and soles can also show the lesions. And recently, it was observed that the patients of monkeypox were developing the lesions initially over the perianal and the genital areas. Okay, this is something to remember. And what are the lesions? So I was telling lesions. So what are the lesions? So they are vesicles which can be itchy. Sometimes the vesicles can be associated with pruritus. And also remember, these vesicles can be having pus inside them. So initially, there will be clear fluid-filled vesicular lesions, but ultimately, if there is a secondary bacterial infection, there can be collection of the pus which can be seen. And it was observed that the lesions can range from a size of 3 to 15 millimeters, and there can be lesions ranging from hundreds to even thousands of them present over the body. And mainly, we can also see the lesions present over the centrifugal area, that is the extremities. And here in this picture, you are able to see the presence of the scab over the genital areas. And here you are able to see there are vesicular fluid-filled lesions present over the genitalia. And these are some of the other pictures where you are able to see various types of lesions, but predominantly what we are able to see, vesicular lesions. And this is another picture where vesicular lesions are present. And if you observe, there is central depression in these lesions. And this is particularly called as central umbilication. So mucosal involvement will be there initially, and there will be macular lesions which will be developed. That is neither raised nor depressed type of pigmentary changes will be seen over the skin, followed by papules, which will be developed. Later on, there will be development of clear fluid-filled vesicles, as you are able to see here. And there will be collection of the pus, because of which the patient may experience pain. And later on, you can also see umbilication. So that is the central depression which you are able to see in these lesions. And there will be crusting later on. And finally, the lesions are going to heal by forming scab. And also you can see scaling, as you are able to see here. And ultimately, lesions can heal with a very, very bad scars, which are called as pox scars. And the patient may also develop petechiae due to extravasation of the red blood cells. There can be necrosis and also ulceration developing at the sites of the lesions. So these are some of the images where you are able to see the involvement of the mucosa, followed by the involvement of the face, where you are able to see the vesicular lesions and also vesiculopustular lesions, which are having the central umbilication. Very classical images these are. And how can we diagnose it? We can diagnose with the help of the polymerase chain reaction taken from the fluid of the vesicles. And what is the treatment? Please remember, and cases should be isolated and contact tracing should be initiated. Close contacts of infected individual requires isolation for a period of 3 weeks. Why? Because the incubation period is from a range of 1 to 3 weeks. Supportive treatment can be given. Treatment of secondary infection, if any, and also pneumonia and corneal infection may be required. Specific treatment in the form of cidofovir and tecovirimat. These are the treatment modalities which can be used. And also remember, very, very young patients, malnourished patients, pregnant women, and immunocompromised individuals. These are susceptible for more severe disease. So we have to be very careful in these individuals. Smallpox vaccination offers a significant protection up to 85% against the related monkeypox virus, which is also called as MPOX. The risk benefit of vaccination should be considered for high risk contacts also. Okay. There are other strains also which are coming up, but yeah, rest assured, whenever you see any patient with the symptoms of fever followed by this kind of a vesiculopustular rash, first thing we have to do is to send the patients to a proper dermatologist so that they will observe, they will monitor for any skin lesions which are present, or they will keep the person under observation so that if they are developing any lesions which are similar to monkeypox, we can also trace the contacts and be very cautious to prevent any further spread of this monkeypox viral infection to other individuals. Okay. So I hope you got some important information regarding the monkeypox from this video. If you have got such information, please do hit that like button and also do share this among your friends and family members for them to be aware of this new virus, which is, like coronavirus. This is the latest one, which is a global threat, which everyone has to know about. And also do subscribe to my YouTube channel for this kind of a latest information related to dermatology. Thank you so much